The public health infrastructure of Bolivia has a poor geographic distribution that does not meet the current demands of its population. Bolivia has the worst health indicators in South America, reflected by the high rates of maternal and infant mortality in the region. In many rural communities, the lack of adequate health services restricts access to its benefits, especially for mothers and children. Many existing health centers are inadequate, as they are not suitable work environments and often lack basic services. Because the Bolivian government and municipalities are financially limited to implement policies, programs, and health education in communities, the provision of basic health services, such as delivering a child or providing emergency care, is very difficult. Our infrastructure program develops the construction of health posts, health centers, and hospitals for basic care. It began in 1996 in response to communities' and municipalities' unsatisfied demands for improvements in health and education infrastructures. Because these communities lack the proper economic resources to complete these projects on their own, they require an additional support. All of our projects are developed with the working model of empowerment and local participation in their own development. The municipalities and communities participate financially by supplementing the funds raised by Mano a Mano Bolivia through individual donors and organizations. Under this model, Mano a Mano Bolivia has built, equipped, and opened 149 primary care centers in 47 municipalities as of October 2014, where each health infrastructure is operating with health personnel and medical supplies under the Bolivian government. In addition, our health education program, composed of a team of medical volunteers from various fields, provides training to the physicians, nurses, and dentists working within the health facilities we have constructed. They offer training in areas such as public health and disease prevention, management of medical emergencies, medical specialties, and evidence-based medicine.
Tiene que ir hacia atrás y hacia arriba.
Mano a Mano Bolivia organizes training courses for people interested in working with the local health system through the Health Promoter Education Program. These courses are developed by the medical staff and volunteers from the central office of Mano a Mano Bolivia, in coordination with the support of the staff at each health center, which are all equipped with the adequate materials to ensure optimal education and practice. Through our medical and dental outreach clinics program, trips are planned and implemented with the participation of volunteer doctors, dentists, and nurses. In most cases, the organized teams travel to remote rural communities by aircraft or vehicles on roads that are inaccessible during various hours. Mano a Mano Bolivia organizes the logistics and provides the medicines and medical equipment needed. Our organization seeks to build a health clinic in rural communities in Bolivia, and we need your help. This clinic will provide much needed health care to rural Bolivians who have no access to medical care services. The construction and stocking of these facilities will allow an entire community to obtain medical and dental care, receive preventive health care measures that will reduce the burden of common but often untreated illnesses, and decrease maternal and infant mortality. The cost of building and stocking a Type 1 health clinic is $79,975 US. And for a Type 2 health clinic, the cost is $99,800 US. A Type 1 health clinic includes a doctor's office, a nursing room, an inpatient room, and is suitable to attend to the needs of about 2,000 people. A Type 2 health clinic is equipped with various doctor's offices, a laboratory, a pharmacy, 2 inpatient rooms, a dentist office, and has the ability to answer to the needs of more than 3,000 people. These amounts cover the cost of construction, materials for the building, examination tables, furniture, kitchen items, and supplies to fully equip the clinic. Because it is a mandatory requirement for all of our projects to have an economic participation of the municipalities and the beneficiary communities, we need to fundraise $34,937 US for a Type 1 clinic to begin its construction. For a Type 2 clinic, we need to raise $44,390 US before we can begin. Help us make the building of a new clinic a reality for a poor village in Bolivia.
Ja.